Many people consider cayenne pepper to be the king of medicinal herbs. In fact, these peppers have been used for thousands of years to help treat many health problems. Not only do they have medicinal properties, but cayenne pepper is also great for cooking, and it contains several beneficial nutrients. Cayenne peppers are a type of chili pepper. They belong to the nightshade family of flowering plants, and they're closely related to bell peppers and jalapenos. They were originally grown in Central and Southern America, but they were brought to Europe in the 15th century by Christopher Columbus. Capsaicin is the active ingredient in the cayenne pepper, and it's what gives them their medicinal properties. It also gives them their hot taste. In fact, how hot a cayenne pepper is depends on its capsaicin content. The more capsaicin that it contains, the hotter that it is. The capsaicin in cayenne peppers has metabolism boosting properties. It helps to increase the amount of heat that your body produces, making you burn more calories per day. It does this through a process called diet-induced thermogenesis, and this causes an increase in your metabolism. In one study, people who had a breakfast that contained capsaicin and medium-chain triglyceride oils burned 51% more calories during that meal when compared to people who had neither for breakfast. But while capsaicin helps to boost the metabolism, the overall effect is small. In another study, people who ate 1 gram of red cayenne pepper only burned 10 more calories over 4.5 hours when compared to those who didn't eat any cayenne pepper. It's also important to know that people who regularly consume cayenne pepper don't continue to reap the same benefits, as the body adapts to the effects. Interestingly, cayenne pepper can reduce your hunger, helping you eat less and feel fuller for longer. Many studies show that the capsaicin in the cayenne pepper helps to reduce the hunger. How it does this, though, is not completely understood. But one study showed that it reduces the production of the hunger hormone ghrelin. One study showed that people who were taking capsaicin ate less food throughout the day than those who didn't take any. Specifically, those who were taking capsaicin supplements ate 10% less, while those who drank a capsaicin-containing beverage ate 16% less. People in the same study also reported feeling fuller while eating fewer calories. High blood pressure is a huge health risk worldwide. In fact, over 40% of adults over 25 have high blood pressure. Interestingly, animal studies have shown that the capsaicin in the cayenne pepper can reduce high blood pressure. One study in mice with high blood pressure showed that the long-term consumption of dietary spices that contained capsaicin helped to reduce the blood pressure. And another study showed that the capsaicin helped to relax blood vessels in pigs, leading to lower blood pressure. It's important to note that the findings above are based on animals, and capsaicin's effects may differ in humans. Dietary spices and their active components may provide many beneficial effects to your stomach. For example, the cayenne pepper may boost the stomach's defenses against infections, increasing digestive fluid production and helping to deliver enzymes to the stomach, aiding digestion. It does this by stimulating the nerves in the stomach that signal for protection against injury. While some believe that spicy food may cause stomach ulcers, a review paper has shown that the capsaicin in cayenne peppers may actually help to reduce the risk of these ulcers. Capsaicin has potent pain-relieving properties when it's applied to the skin in a cream. This is because the capsaicin helps to reduce the amount of a substance P, a neuropeptide produced by the body that travels to the brain to signal pain. When less substance P is produced, pain signals can no longer reach the brain, and feelings of pain decrease. Capsaicin is available as a skin cream, and it's often recommended for the following conditions: joint and muscle pain, lower back pain, pain after surgery, and pain from nerve conditions like shingles. Additionally, it's important to note that capsaicin cream should not be applied to an open wound or broken skin. Autoimmune disease are conditions where the body attacks itself. Psoriasis is an example of an autoimmune disease, and it appears as patches of red, itchy, and scaly skin. You can check out my video on autoimmune disease for more natural treatment options of these conditions, and my video on psoriasis. Currently, there's no cure for psoriasis. However, capsaicin creams can help to relieve itching and to improve the appearance of psoriasis-affected areas. One study showed that psoriasis patients who were treated with capsaicin cream had significantly reduced scaling, redness, and patchiness than patients who received a placebo cream. It's believed that the substance P plays a role in psoriasis. As mentioned previously, the capsaicin helps to reduce the amount of substance P that's produced by your body. Cancer is a disease and it's characterized by uncontrollable cell growth. The capsaicin in cayenne pepper shows promise in reducing the risk of cancer. It may do this by attacking many different pathways in the cancer cell growth process. In fact, studies have shown that the capsaicin can slow the growth of cancer cells, and it can even cause cell death for many different types of cancer, including prostate, pancreatic, and skin cancer. While capsaicin's effect on cancer cells seem promising, it's important to note that the current findings are based on lab and animal studies. Capsaicin's effect on cancer has not yet been evaluated in humans. Cayenne peppers are generally recognized as safe to eat. However, eating too much cayenne in one sitting may give you a stomachache and make you feel sick. If you're taking medications for high blood pressure, such as ACE inhibitors, check with a doctor before taking capsaicin cream. If you're taking a blood thinner like warfarin, also check with a doctor before taking cayenne peppers, since that could increase your risk of bleeding. And when applying capsaicin cream to your skin, do not apply to an open wound or broken skin. The famous herbalist Dr. Christopher would add cayenne and lobelia to all his formulas, as he said that it had an adaptogenic balancing effect on all problems in the body. For more information about herbs, supplements, or health conditions, check out my website.